I want to introduce Alyssa Pfister. Alyssa, thanks for being here.
Thanks for having me, Dr. Paul.
Alyssa and I go way back to Tenwick Mission Hospital, where we worked there intermittently for months at a time. And you were there for 2 years, weren't you?
I
2
was.
years during your
Right out of
post-residency
residency.
program?
Yep.
Yeah. And I specifically remember one trip we took together because I did surgery, you did pediatrics and internal medicine, but we took that one trip to Infantino Island. You remember that?
Yeah, I remember trying to take care of a pregnant lady that really needed a lot of help that was beyond either of our usual skill set, but we did the best we could and we got her to care.
I remember our hearts were beating very fast. This lady was bleeding postpartum, and there was no blood on the island, and trust me, we had to pray and act quickly, and fortunately she did very well.
Jump on a motorcycle to help her out.
Wait, did you say a motorcycle? Like really?
We did, yeah.
Wow.
And then a boat.
And then a boat.
Yeah, so.
I don't think most of us who live in North America and really parts of Europe and a lot of parts of the world really have an understanding of what the conditions are like in places like that, do we?
Yeah, Alyssa works now as a career missionary in probably one of the poorest and neediest countries in the world, Burundi. Contextualize that for us, Alyssa. What's it like?
So Burundi is actually a really beautiful country. So we're just 3 degrees south of the equator, but the elevation is high, so 5,000 to 6,000 feet, which means the climate is perfect. It's 70 degrees year round. The hillsides are full of green banana trees, really as far as the eye can see. It's a very densely populated country, but it doesn't feel that way. It feels very just beautiful. God's creation is shining brilliantly there. There's also a lot of poverty. Burundi is one of the poorest countries in the world, bottom 5 on most statistics you look at. The Burundian children have a lot of struggles with malnutrition particularly. So as a pediatrician, that's something that I come up against every day. We have about 60% of Burundian kids are chronically malnourished and stunted in their growth.
Would you say that again?
60% of Burundian kids under age 5 are chronically malnourished. So that's the average. So in our area, it's actually maybe a little bit higher than that because we're in a more rural setting. The average Burundian woman has nearly 6 kids. So there's just a lot of children, a lot of people to feed, and just not enough land to feed that many people.
Some of us know this, but some of us don't. What does chronic malnutrition do to a child, especially during those critical years?
Yeah, it really puts them behind in every area. So a lot of developmental delay. Severe malnutrition impacts every organ system. So these kids are immunosuppressed, they have heart failure, their kidneys and their liver don't work well. Their brain, everything is really affected, which means if they catch a simple cold or gastrointestinal illness, they can get really sick more than other people would.
A lot of the kids that die every day in sub-Saharan Africa are malnourished kids that just get a simple infection that normal healthy kids would fight off, but they can't fight that off.
Exactly, and in our area, malaria is the big problem. So Burundi has 11.5 million people. Last year, in 2019, there were 8 million cases of malaria.
Goodness, 80% basically.
So yeah, most of the population and a lot of deaths. So our hospital's been bursting at the seams.
Yeah, now tell us a little bit about the medical care availability and the medical education when you arrived there 7 or 8 years ago.
So when we arrived, there was a doctor density of 3 doctors per 100,000 people. I think it might be up to about 5 doctors per 100,000 now, but that's very few. The U.S. has nearly 300 doctors per 100,000. I think Houston has over 500 per 100,000. So it's there's great medical need, great need for more healthcare workers. That's just doctors. We need more nurses, anesthetists, optometrists, all those other specialties as well. Studies show that places that have fewer healthcare workers have higher child mortality rates, higher maternal mortality rates. So simple measures could really make a big difference. What about, so our hospital trains healthcare workers.
Are there not enough healthcare workers, and there's very little in the way of training right now? Is that right?
So there's
or at least 8 years ago.
Right, exactly. So our medical school is pretty new. So there's been a university medical school for a while. There's another small private one up in the northern part of the country. And then the president of Burundi actually asked Hope Africa University to start a medical school back in 2005. Because he saw the need for more doctors in Burundi. At the time, they didn't really have faculty, and they heard about our team. The rector, the bishop of the university, found us and had really had a vision, particularly in his mind, for 6 specialists up at the rural teaching hospital. Our team had 6 doctors at the time, and so it was totally a God thing just to make that work.
Wow, that's amazing. You know, your approach to missions, for so many years, you know, a man or a couple would go and they'd go by themselves and they'd kind of do missions by themselves for a long period of time. Hopefully they'd be joined by somebody. Maybe they would join a small team. But you guys did it totally differently. And I think it's really the wave of the future for missions. Tell us how you guys did it.
Yeah,
And are doing
so
it.
I certainly would not have been able to, I wouldn't have survived had I'm single, to go off on my own to rural Congo or something, like, I wouldn't have lasted more than a few months, I don't think. But our team, 3 of the original families were together in training during medical school and residency, and we're all interested in missions. 2 of them actually are missionary kids, so grew up in Africa. And at some point, they started to say, maybe it's not just a coincidence that we all have complementary specialties, we're all interested in missions, we'll all finish training at the same time. Maybe God has called us together for a purpose. And so they prayed, they developed a shared vision, and ultimately they ended up at Tenwick Hospital. For the same 2 years I was there, we all were with Samaritan's Purse post-residency program. So right out of residency, we all went directly to Africa and had 2 years there at a well-established mission hospital where they have mentors and others who could really help us get our feet on the ground in African medicine. And then our team together looked for a place where we could serve long-term with a vision for medical education and community. So training African national medical professionals to care for the least of these, doing so as a community. Burundi was a great fit for us.
7 years ago, you guys moved, is that right?
So yes, 2013.
2013,
we moved to
you
Burundi.
guys
So we had to
moved.
do a year of French language study, and we had to do some support raising and tropical medicine training after our time
And
in
you guys
Kenya.
have been there now 6 or 7 years.
Yep.
And what's it like now? Is the team still together? Is it growing?
Yeah.
What's happening?
So the team is doing well. So within 3 years of arrival, we had tripled in size. So we arrived with 16 people, 8 adults and 8 kids, and we're now at around 50, about half adults and half kids. We continue to work with our Burundian national partners. They're the ones who invited us there. The medical director of the hospital is Burundian, the rector of the university is Burundian. These are the people that we work under, and they continue to direct the program. We do see amazing changes. Almost every square inch of the hospital has been renovated over the last 6 years. We have a brand new surgical ward, which our surgeon, Dr. Jason Fader, got a grant for. We have a brand new pediatric ward opening this summer, which I'm very excited about. So 130-bed pediatric ward coming soon, which is very exciting. We've had a lot of help from Engineering Ministries International to help develop the infrastructure of the hospital. And then our mission surge really helps us in so many ways in making it possible for us to be there long term.
Yeah. Would you not say that over the course of the last 7 years, things are beginning to change as far as the landscape of education in Burundi?
Yeah, it's actually really interesting. I was able to talk this morning with some people working with the American Academy of Pediatrics about neonatology and thinking about where we came from 6 years ago. Just in my specific area, I'm not a neonatologist, but there aren't any neonatologists in Burundi. So when I first got there, the little babies were in cardboard boxes on the mother's beds. Like nobody was even counting them as patients or providing any specific care for them. And little by little, with the help of a lot of folks in the U.S., even people that I had cared for as patients, people that are from my church back in Birmingham, we were able to develop a NICU. So now we have about 20 beds. We will have more with this new pediatric ward that opens up. And we've had babies as small as 870 grams survive. We've had 900-gram babies survive.
That's amazing.
Babies born at 27 weeks gestation. Now, they don't all survive. We still have a high mortality rate and much higher than we would like it to be. But so many babies that would not have a chance really anywhere else in the country are living now.
That's amazing. Can you really fill up 120 beds, 130 beds pediatric?
Last year during peak malaria season, we had 135 patients at our maximum time.
Children?
Children.
That is
Just
amazing.
kids. Yeah, no, the whole hospital is going to be around 300 beds. When our team arrived, it was around 100 beds. So we're
Comment a little bit, Alyssa, on just the burnout and the compassion fatigue and just the exhaustion that I see when I travel to any mission complex. How I think this team approach and this community approach, kind of holding each other accountable, and as you said earlier, having your own Sabbath, how does that produce and promote longevity on the mission field?
I think it's really crucial, and I don't think it'd be possible to survive without the community focus, like I said. So I have teammates who are very strong in articulating what the rest of us experience but can't really say. So my teammate, Dr. Eric McLaughlin, wrote a book called Promises in the Dark, Walking with Those in Need Without Losing Heart. And I think that's a big challenge for all of us, even when we walk with family members or friends where there's problems that just aren't easily solved.
Yeah.
The just long-standing chronic challenges that everybody faces in their life. And how do you deal with that without losing heart? How do you keep going? How do you not become cynical or bitter or just give up entirely?
Yeah.
Or just become so depressed that you can't function? And I think supporting one another, on my hard days, I find some of my teammates and I talk with them about it, and we walk together, we share together, we talk about how we have a God who suffered. Jesus himself was the suffering God, and so he identifies with us in our struggles and with our patience. And we celebrate the successes. God has created kids to be so resilient, and most of them get better, which is really exciting.
Yeah.
So we see him making all things new, little by little, his kingdom coming. So we celebrate the miracles, the miraculous recoveries.
Yeah, that's amazing.
And that sustains us.
Let me ask you a hard question. I don't think I've ever asked anybody this, especially in a missions context. How do you keep disunity out of that group? Because once there's division, once there's strife, things begin to get very bad very quickly. How do you keep that out of your community there?
So conflict can actually be healthy, and all communities have conflict. It depends on how you approach it and whether you can approach it with humility, with repentance, with forgiveness. I think in our setting, what we talked about early on was having what we call meddling rights. So being willing to speak into each other's lives in a gracious, grace-filled way. Our mission emphasizes the core value of ministering from weakness. And I think that's very countercultural to our American culture, to our doctor culture, where we tend to be the ones who want to be independent, to have it all together, to really make our way in the world. And that's not what Jesus has called us to. Paul says, Jesus says, grace is made perfect through weakness. His grace is sufficient for us. And so if we can come alongside one another as weak, needy fellow human beings, dependent on one another, dependent on our national partners. I can't live in Burundi without having good relationships with my pediatric team, the Burundian doctors and nurses that I work with. I can't be the one who's always the authority, telling them what to do. I have to be needy, to be with them, to be alongside them. I think that's really the key, is to not come at it with an authoritarian sort of perspective. But
posture of humility goes a long way, doesn't it?
it's hard. It's not easy.
It's very difficult, especially when somebody's speaking truth into your life and you may not want to hear it.
Exactly. Yeah.
Well, let me ask you, if somebody wanted to know more about Kibuye Hope and what you guys are doing, how would they find out on the internet, on the web?
Yeah, so the first place to look would be at our mission organization, Surge, so surge.org, SERGE.org, and then they can look through the various projects and missionaries.
Great.
And then our team blog would be the other place to go. So that's www.mccropters.com, so MCCROPDERS.com.
Let me ask you, if they wanted Eric's book, how could they get Eric's book?
Eric's book is on Amazon, or it's through New Growth Press.
Give us the title one more time.
Promises in the Dark.
Yeah, I've heard
By
several
Eric
people talk
McLaughlin.
about it, and thank you for bringing me a copy today. So
Yeah, you're
that's
welcome.
great. So,
Alyssa, awesome to have you here, and it's so great to have you watching here on this live stream, coming to you live from Lakewood Church for the Mobilizing Medical Missions Conference.